the budget really responds to the needs and priorities of the people. And nutrition is a key priority area.
Every issue is a budget issue.
Budget documents do seem to be technical.
The decision makers that we're targeting, most of the time they don't prioritize nutrition.
Kenyans are now more interested in the budgets and also in participating.
Hello viewers and welcome to SEHub Podcast, and today we are recording live from Swiss Berlin in Kileleshwa, and we are in a 4 days workshop that is on budget making and civic engagement, and this one is sponsored by Care Kenya and also GAIN in a project called Cascade. We are here a consortium of youth groups. We also have part of the government represented and also youth advocates in Nairobi. Our topic today is on budget, the budget of Nairobi County. Why understanding county budgets matter for nutrition and accountability. Because as youths and also citizens of Kenya, we should put our leaders to account in everything that they do because they represent us. And our theme today, our focus theme is nutrition advocacy, county budgets, and citizen accountability. To unpack this topic, I'm joined by experts in the budget making space. They are from SEHub. For the last 4 days, they have shared their knowledge around this, and they will introduce themselves. From there, we shall take it up.
So my name is Andenga Danpol. Andenga Danpol is a budget facilitator for the city county of Nairobi and SEHub. And I'm glad to be here.
My name is Isaiah Onyango. I'm also a member of Nairobi Eastern and Central Regional Budget Hub and also a budget facilitator for Nairobi and Kiambu County.
My name is Christopher Kuria. I'm a budget facilitator as well from the Nairobi Eastern and Central Region Budget.
My name is Juliet Kisilu, budget facilitator, SEHub, Nairobi.
Good evening. My name is Alfayo Dalai. I'm a budget facilitator under the SEHub in Nairobi County. Thank you.
Our first segment will go around why the county budgets matter for nutrition, because we came here to talk about nutrition and also to ensure that nutrition sector is well financed, because we understand that nutrition really affects like every aspect of our life. If you're not healthy, we can't really work well. If we do not get good health, a lot will really be derailed, right? Why is it important for nutrition advocates and community organizations to understand county budgeting processes?
All right, so I think for me, I will say the main reason is nutrition champions and community-based organizations are operating at the community level, and that means basically they know the context in as far as nutrition is concerned in their communities, but also in the county. And on that basis, it is important for them to understand the budget so that they're able to know how they can influence the prioritization of nutrition, but most important, the allocations towards nutrition intervention in the county.
My input would be the key thing for the champions to engage in the budget process basically is to make sure the budget really responds to the needs and priorities of the people, and nutrition is a key priority area. Without our participation, then there's only one thing which is going to happen. The budget will always look like the governor because it will be 100% his manifesto. But then when now the champions are trained and they engage, they'll bring the citizen perspective into it, and then the nutrition, which is a key area for them, will be a factor to be considered.
Thank you. So from where I see it, every issue is a budget issue, including but not limited to what nutritionists do or nutritionist advocate do. So for them to understand and advance their issues inclusively, they must understand data around budgeting, and more specifically, county budgeting, to influence change within that which they are looking for.
During the training, you walked participants through the County Fiscal Strategy Paper, the CFSP. For many people, these documents feel technical and inaccessible. Could you help our listeners and our viewers understand this? What exactly is CFSP and why does it matter?
Well, budget documents do seem to be technical, but it's just a matter of getting to understand them. And we do have simplified versions of this. So when you go for the public participation forums, you will always find a simplified version of whatever the government is proposing to do at that time. So the CFSP is a strategic paper, just the way you plan your budget at home and how you're going to spend your money, how you're going to project. So how you project, how you're going to, how you perform, how much you want to spend on a certain sector. So the same way you budget in your house is the same way we budget in the county. So this paper just describes how much you want to give per sector, just like you do for clothing, rent. So it's just a matter of getting it simplified so that it does not become technical and it becomes easier for wananchi in each and every sector, including nutrition, to understand.
For me, it's just a document to break down on your expenditure and what you need to spend on. Just simple as that.
Awesome. One of the workshop themes is governance, positioning, and budget architecture, right? And sometimes governments make strong commitments on nutrition, but the funding doesn't match the promises, right? How can civil society and community organization identify this gap between policy commitments and actual budget allocations?
One of the things that we've been saying throughout this training is our government has commitments from all levels, global levels, if you think about the Sustainable Development Goals, regional levels, if you think about the African Agenda 2063, and of course, coming national, we have Kenya Vision 2030. So I think the role that CSOs have, one, is to actually be aware about these commitments. Once CSOs are aware about the commitments, it is now easy to hold the government accountable. I'll give an example. We have, for example, the Abuja Declaration, and part of the Abuja Declaration is very clear that the government has committed to committing at least 15% of its budget to go towards health. So with this kind of information, CSOs should be checking to see to what extent are their governments actually realizing this. And if not, what is the gap? Using that kind of evidence, it is now easy to hold them accountable and tell them, increase the allocation towards health. And subsequently, if that is met, then nutrition also is able to get an allocation. Yeah.
So these policy goals basically they try to give the entire world a direction, and it's in that particular process they're giving a continent a direction, which is the region, and also a country. So us as CSOs, our role basically is to understand that when resources are being allocated, these commitments were signed. The government was able to play that they're going to make sure the implementation is 100%. And therefore our role is to make sure we track the budget, we keep on checking how well are they making sure that these targets are being realized, these objectives are being achieved. So our role basically is just knowing these targets and then knowing that our government was committed to implementation and realization of them, and then now tracking how well have we been able to attain these particular goals by just looking at tracking the budget, how much was allocated, how much was spent, what gap is still remaining, and what can we be able to do, and any explanation or justification as to why we haven't really been able to achieve 100%.
Awesome.
I think I just wanted to add on what he had said already, but my part would be, is there a justification? Is there a reason as to why government may not have spent up to the 15% as is suggested in their budget declaration? Now, that can only be identified if you track the health budget. So as CSOs, it's very important, imperative for them to understand, analyze, and track the allocation of health within the physical years. Okay, so that now can give them, it can give them an understanding, it can give them an impetus, it can give them a way forward as to what to advise government to do in subsequent financial year.
Maybe I could just add that these commitments sometimes become very difficult to track, but between the CSOs act as a bridge. So CSOs, also being very active citizens, are able to gauge has this commitment been achieved? So sometimes data may say that we have achieved, but down on the ground we can see, the hunger is too much. We've learned about nutrition specific whatever, all those things. So the CSOs will play that critical role in ensuring that the measures, the commitments that have been made are really adhered to.
Yangu nitasema kuwa mashirika ya kijamii yako na majukumu ya kuweza kufuatilia hizi bajeti na kuweza kuangazia serikali zile ziko sana sana hizi serikali gatuzi, make sure kuwa ile pesa ama ile fedha ambayo inafaa ije kubadilisha mambo ya nutrition katika jamii imeangaziwa pale, na pia waweze kusukuma iweze kuwa increased katika hizo budgets.
Also, all these targets are actually services and needs of the people. As CSO, sometimes you're pushing for good health. When you're advocating for the same and tracking, in one way or the other, you're helping the county government and national government attain these particular goals. Okay, push for agriculture, nutrition. To some extent, you're helping the government attain these goals. So CSOs, we're just making sure they're pushing for improved service delivery, better governance, better infrastructure. In one way or the other, they are pushing the government towards attainment of these particular targets.
Awesome. Now, our second last segment, that is on technical budget analysis and fiscal literacy. Another key theme from the workshop was technical budget analysis and fiscal literacy. Often, citizens want to engage in governance processes but feel intimidated by technical documents. What are the most important fiscal documents citizens should understand when doing nutrition budget advocacy?
I think first of all is to appreciate that we have all budget documents are important for nutrition champions to understand and to be able to track budget allocations. But when it comes to the county government level, the most important document to begin with is the County Integrated Development Plan. So as we know, every governor upon election and taking office, they have to come up with a county integrated development plan for the first 5 years they're in office. And this is very important because remember, this is what is going to inform generally the intervention that this governor and this government is going to undertake. And that includes health, that includes nutrition. So before we get to any budget document happening in every fiscal year, this is of paramount to the nutrition champions, because they can influence and ensure, first of all, in the county integrated development plan, the nutrition has been factored as a priority. Once that is done, then it becomes easy when we come to each fiscal year to now consider each individual budget document and how the commitments in the CIDP are reflected.
After the CIDP, we will come to the ADP, which is an annual plan. And basically is an extract of the CIDP. So like you said, all documents are important, but I think the systematic flow of what happens, that we plan and then now we approve and then we implement and audit, makes it difficult to actually say that this is the most important. But at times we do say the CFSP is the most important, because this is what now shows how much we are going to spend per sector, the projections, the performance, the ceilings. So arguably, it is the most important in the process.
That is CFSP?
Yes.
Awesome. That is the
County Fiscal Strategy Paper, yes.
It gives you the size of the budget to be spent by any particular county. Now, those budgets are drawn from the plans. Which plans he has spoken to? Yeah, the wider plans, the master plans, the CIDPs, to an ADP, and then CFSP speaks to the specific budget that must be spent within a financial year. So actually, we tell many CSOs that when you see a CFSP, an approved CFSP is as good as the budget itself for the year. For me, I believe the most paramount document is the CIDP, first of all, because now it's the entire 5-year plan, whereby when we miss out all this, then it becomes very technical for us to start lobbying for budgets on health and nutrition.
I want to say that also another key important document is the annual development plan, because after we've been able to make sure we've pushed these in nutrition priorities into the county integrated development plan. We have to also make sure they are captured in the annual development plan to make sure they are featured in the upcoming financial year. And then another key document which is important is the county budget review and outlook paper, CBRO, because it will be able to provide the priorities which are in the budget with regards to nutrition. What happened to them? Were they implemented? How much money was allocated? How well was it absorbed? What targets were we able to realize? What remained? And then what guidance and proposals are we getting from the CBRO towards the upcoming budget to make sure the challenges which we learned are corrected going forward? So that is also key. And lastly, program-based budget, the budget estimate. So after CFSP has given us the size of the budget and priorities, which are the nutrition is a priority, then now program-based budget will be able to break it down beyond nutrition towards looking at stunted growth, now being able to look at the nitty-gritties and allocating decent resources to make sure we are addressing each and every element of nutrition.
Awesome. So for the next time, we shall really tackle more about that, because it's a very interesting thing. It's for public to understand and also like participate and also hold the government accountable, especially in the area of nutrition. We go for a quick fire. So, Mr. Alfayo, one document every nutrition advocate should read. 1, 2, 3.
CBRO.
CBRO. Why?
You have pushed me. I was thinking.
For me, I think it's budget advocacy needs times. So much as we can do our advocacy as nutrition champions, seeing change happen in the budget it needs time, honestly. We're talking about you looking at it from one financial year to the other. And as we know, the resources are limited. Again, the decision makers that we're targeting, most of the time they don't prioritize nutrition. So there's a very big case in budget advocacy where you are trying to, for example, make the case for service delivery, for health and nutrition to decision makers in our country who are more oriented towards, development, roads and all that. So I think that to me is a challenge, but still, I think advocacy is a long-term engagement. So as long as people are able to engage consistently, change is definitely realized.
All right, back to you, the only lady in the panel. Are you ready?
Yes.
Mm-hmm. One word that defines accountability.
Transparency.
Transparency. Maybe you could expound a little bit.
When we speak about accountability, you need to be able to see everything in details. We want to see the realistic. If it is allocations, we want to see these allocations were done. We want to see the implementation, and all this needs transparency. So we need transparent budgets. We need that honesty to be able to know that this is unaccountable. Using the same word, yes, but I would say transparency and even the visibility to be able to gauge on how accountable a project has been done, or yeah.
So I'm going back to Mr. Alfayo. I'm sure you are ready now. Okay, what gives you hope about citizen participation in Kenya?
Basically, what I've seen throughout the previous years, Kenyans are now more interested in the budgets and also in participating in these processes. And then they are coming out to question their leaders and also following up on their taxes. That is the only hope I have.
That's awesome.
Yes.
So there were 4 questions and I've asked all of them, but I'll repeat one for Nzai here. Your biggest challenge in budget advocacy, the biggest challenge you see in budget advocacy is a repetition.
It's budget literacy among the citizenry, basically. It's the biggest challenge. The bigger masses of the electorate don't even know, have no idea the details surrounding budget matters. And therefore they cannot advocate for it because they don't know. So budget literacy, in my view, is the biggest challenge among the masses because they don't know.
I'll just sample one again. What gives you hope about citizen participation in Kenya? Back to you again.
So what gives me hope is seeing what is happening with SEHub, seeing what is happening with SEHub, Coastal Regional Hub, and other CSOs who are stepping up now to start building the capacity of citizens on proper ways to engage, proper ways to participate, and have a conversation with the government towards a budget which is responsive to their needs and not the needs of the government. That is my hope.
I want to add something on that hope.
Yes,
I have hope now because I see more organizations interested in getting citizens to understand their particular niche, like what we've just done now. This is in nutrition. Somebody else wants to understand what is happening in environment. Somebody else wants to understand what is happening in education. And if they are building capacities of citizens on the ground, then we have more champions now coming out to into the space, the budget space, and understanding, oh, this is our role. So I have hope. I actually have a lot of hope because, like in the the last CFSP, we did have a number of women present 17 memos in 17 sub-counties. So you can imagine if this is one sector and we do all 17 sub-counties, another sector, 17 sub-counties. So I have hope and I'm happy.
All right, so thank you so much. It's been nice having you, and I believe we shall interact more on this budget issue. And it's something that you're really doing very well because for me, when I joined this training, I had very shallow knowledge about the budgeting process. It was just like, I was just waiting to see what has been budgeted for what. But now the details around it, what should I do to hold my leaders accountable? That was really strange on my head. It was very foreign. But now I really understand the budgeting process, and I believe with this journey that we've started, more shall really come, and I'll really be like an advocate for this particular process, and even engage more people on the same, so that everyone around me become really in a position to put our leaders to account. Once again, thank you so much.
Thank you.
And we shall meet more. From today's conversation with the Budgeting Hub team, we've learned that the process of budgeting is not all about numbers, the complex numbers as we know it. There are moral choices that we make, and also us as citizens make through our leaders. They also determine, that's the process of budgeting, also determine whether children receive proper nutrition. If you look at budgeting in the context of nutrition, the budgeting process determines whether children receive proper nutrition, and whether mothers access quality health care, and also whether communities thrive or struggle. That is what we've learned from the conversation we've had with our guests today. Understanding county budget is not just a technical skill. It is a tool for accountability, advocacy, and change. Thank you so much, viewers, for being part of this podcast again. I encourage you to subscribe and also to interact with this podcast, as well as you can suggest other topics that you can also engage in. Thank you so much.